Hi, I'm Lisa Tan, Head of Communications here at Oxleas. Welcome to the latest edition of Oxwide, our video showing you what's going on across our trust. Now, we're celebrating the International Day of People with Disabilities, a global initiative to raise awareness. So, what's it all about? We spoke to Craig Hill here at Oxleas to find out more.
I think it's important firstly to recognise who are people with disabilities, and I think that's the biggest challenge that we have really in some respects. So those people with disability, quite often people think about somebody with a physical impairment that can be seen. Well, in fact, actually our network supports a lot more than that. In fact, 80% of people who have a disability that can't be seen. So the network supports those with disability, those with a long-term condition, and also those who are neurodiverse. So it really is a really diverse group of people that we're working for, and we are the voice for those. And why today is important really is really an opportunity for us to celebrate the value that we give in an organisation and how the value of actually the benefits of having a diverse workforce, and that's really important for us, and also some of the work that's been going on. So we're quite excited about today. Today's a big event for us. We've got some guest speakers, normally lots of laughter, a few tears, but it's a really, really positive event showcasing the work that we do, really.
So where is the event? How can people join that?
So the event is actually online. It's an MS Teams online, so which is great. It's given us an opportunity to open it up to a lot of people. And in doing so, it means that we've not only got Oxleas staff joining us today, we've also got people from SLP, we've got Bromley Healthcare joining us. So we've really got a really nice community for the session, and I think that's one of the advantages of technology, is really opened that up for us. So it's a really positive. If you'd like an invite, all you need to do is visit our network page, and there's an email there, and we will send the link over to people. So it's easy to access, and it's a really an open event, so you can drop in and just enjoy the time really.
Fantastic, thank you. So if there was one piece of advice or a message that you could give colleagues about the importance of recognising and trying to understand how the world might be different for those with a disability, what would it be?
For me, I mean, that's a really good question, and it's actually got a really easy answer. And if you think about disability and how it affects individuals, there's no easy, quick checklist to support an individual. So I myself have an unseen disability. I have ankylosing spondylitis. If I had a colleague that had the same condition, a chair set up with me or anything set up for me wouldn't be transferable to them. So my biggest advice would be, if you're working with somebody or you're managing somebody with a disability, a long-term condition, or are neurodiverse, just speak to them, ask them what they need, any support they are, and ask regularly, because conditions change. And I think that's, for me, is the biggest win, and it's an easy win as well. Just have open conversations. And as a network, we spend a lot of time giving people confidence to talk about the disability, because the more we talk about it, the more we understand it, the more we have a more of an open environment, less stigma, and also more supportive environment, and hopefully better for our members and also better for the organisation.
Here at Oxleas, we have 3 priorities, one of which is great out-of-hospital care. Here to explain why it's important is one of our most respected colleagues.
Hello, I'm Dr Abi Fadipe, Joint Interim Medical Director here at Oxleas. Over the past few months, we have agreed a strategy for Oxleas, which outlines our 3 main priorities for 2021 to 2024. This is based on what staff, patients, carers and partners said they would like us to work on. In this film, I'm going to tell you about the big priority 2, great out-of-hospital care, for which I am the Senior Responsible Officer. We want our out-of-hospital care to be the very best it can be by providing people with the tools, skills and services they need to manage their conditions in their own communities. We aim to improve the quality of their lives and the lives of those who support them. When we spoke with you about the care you receive from us, you told us that we could work more closely with patients, their families and with other services in local communities. You said, some services seem to operate independently of the family supporting the patient. There's a real opportunity to work together to provide the best possible care. Early intervention would help prevent people getting to the point of needing to be admitted to hospital. It would be good to have appointments as close to home as possible. Many people that receive support from Oxleas do so in a community setting and over the long term. We want to help people in South East London to lead fulfilling lives and to reduce the negative impact of the health conditions they experience. To achieve this, we need to work in partnership with patients, their families, and other local organisations such as councils, charities, and other healthcare providers. Some of the ways we are planning to achieve this over the next 3 years include continuing to work closely with our partners in health, social care, and the voluntary sector to redesign our services both for young people and adults with mental health issues. Expanding several adult community health pathways, for example, Home First. This supports hospital staff working with colleagues in the community and in social care to plan for a patient to return home as soon as they can. And improving access to physical health checks for our mental health service users and increasing self-management skills for people with mental health problems. These are part of how we plan to deliver the Great Out of Hospital Care priority. We know our staff are key to delivering our aims, and we will equip them with the tools, knowledge, and skills to deliver the best care. We will be asking you to join our great conversation to discuss how we can help you to achieve these goals. I look forward to meeting you all soon.
Finally, we've been asking you to send us your own videos to showcase the latest news and events happening in your teams. But what we haven't done is give you help and advice on how to do it. So I spoke to Robin Bailey from Capricorn Media on the importance of communication skills in the current climate.
Well, we're at an NHS Foundation Trust, and never more has communication and good communication with the public been as important as it is now. I think, with the new advice on face masks and the way the new pandemic, if you like, has morphed into something different. So I think we have to be really keen to get that message clear with the members of the public. So I mean, with the NHS particularly, I think they have to get that message right. We know that all hasn't always happened, and I think any practice you can get in doing that and more experience you can get in delivering that message, the better. I mean, I've had about 25 years in telly, and I always tell everyone that I'm still learning. There are new developments that change the way that you deliver. And one of those developments, and I've got it here, is the smartphone. And the great thing about these now is that they say, don't they, that it's almost like having Hollywood in your pocket, because people are actually making films on these things now. So absolutely, people like yourself, heads of communications, should be thinking about this as a way of delivering their message. And it can very easily be done. Now, I've got a few accessories here, and these don't cost a fortune by any means. First of all, one of the things you've got to be careful of when you're filming with the smartphone is to get the sound right. So something like that, that might be sort of 50, 60 pounds, something like that. But I think this is an Olympus microphone that just connects at the bottom of the phone. Now, that can really help on the sound. If the sound isn't right, strangely enough, the video won't be totally effective. Obviously, you've got to have a cradle for your smartphone, so it will actually attach, and you can put that, if you can, on a tripod like this. And that would just anchor it so you don't have the camera shake and all that kind of thing. But honestly, the smartphones are so good now that they can actually eliminate camera shake. That is, it's got to that level. And just one other thing, if you want to do it the way the professionals do it, this is a bit of iRig kit. It's literally a tap-on mic, a clip-on mic that goes onto, I don't know, in my case it would be a lapel, so you get really good sound. So that's the alternative to doing something like that. But honestly, all these options are out there now. And there are some rules obviously that we would teach people how to do this and empower them to deliver their own video. I think the NHS probably hasn't grasped the fact that they should be using social media much more. They think that this is a young market, and we're all using this. I'm just about to celebrate my 60th birthday, and to be honest, I love it. I love engaging in it, and it's a really quick and easy way to get that message across. So I would say it's something that has to be tapped into. Now, the problem with it is that traditionally people think of television programs as, I don't know, half-an-hour programs that you might see on your television. But when it comes to social media, you're probably looking to get your message across in maybe 2 minutes tops because of attention span. You want to maximize the audience, so you don't want them thinking, well, I haven't got 15 minutes to watch this film. So how can you actually maximize the option? And the other option is maybe having that 15, 20-minute extravaganza about what your foundation trust is doing, but maybe on social media, putting out those individual pieces of film which are going into that. And that's another way of doing it. So my feeling is that this is the way it's going to go. It's very easy to film your own stuff. People with not a massive amount of knowledge can do very well with this. The only thing I would say that if you're talking to camera in the way that I am here, and I've got the camera right here, get that camera at eye level. If you happen to be doing it on a laptop, make sure that you're looking at the laptop lens, not at the person you might be talking to, because you don't want to be looking down on your audience. And similarly, you don't want to be looking up. So get your camera at eye level, whatever kind of camera you're using. And of course, a lot of the time, it's going to be one of these iPhones.
That's all for this edition of Oxwide. I hope you enjoyed it, and we'll see you soon.